Last month, the Firefighter Cancer Registry Act became law, and the hope is the registry will help researchers better understand the link between firefighting and the disease. But what do we know about the risks that this line of work holds, and what steps are taken to help keep firefighters safe? Pittsfield Fire Department Chief Robert Czerwinski and Dr. James Mazo of St. Francis Hospital shared their thoughts with me.
Well, I think that's a good move for all the firefighters, okay? Creating a national database to see where we've got highs and lows and what types of cancer are affecting what type of people. I think what we typically find is, again, the longer that you've been in the fire service, the better your chances are of getting some type of cancer. So by tracking this, we'll be able to give some idea to the young guys what they need to do to protect themselves in the long term, in the long career.
Yeah, and I'd like to talk a bit more in a second about some types of preventative measures that people can take. But Dr. Mazo, let me bring you in. What this says is that the Center for Disease Control and Prevention will set up a database that'll study the possible links between fumes, toxins that firefighters are exposed to, and the risks of cancer. Possible link. That stood out to me as strange. Don't we already know that there's a link between these things?
We don't know a strong link. A lot of the studies that have been done previously are very small. A lot of these things are dose dependent, so the more carcinogen you're exposed to, the more cigarettes you smoke, the higher the incidence of lung cancer. There's also a lot of confounding variables. What is the firefighter's diet? Do they smoke? How much alcohol do they intake? Are they obese? What's their physical fitness? All of these things have a lot of overlap and overplay, as well as genetics on whether people develop cancer or not.
But I've read that firefighters are 3 times as likely as the general public to contract some form of cancer. So don't we link this to occupation in some way, or no?
We can. It is a causal relationship. What exactly that means as far as numbers, what are the risks, what is the passive amount of smoke that a firefighter is inhaling on the fire ground, not wearing their SCBA because they're not acutely in the fire, doing acute fire attack. Those are a lot of variables that we don't really have a handle on.
SCBA, is that a breathing device or?
Self-contained breathing apparatus.
Yep. And so, Chief, for you now, you've been involved in the firefighting industry for quite some time now. Not meaning this to age you, I knew that's where you were going to go with this. But just to speak to experience, when you're at the scene of a fire, are you more concerned about toxins that you might be exposed to maybe versus 30 or 40 years ago because of computers and things like that?
Obviously, yes. Our guys are I think firefighters as a whole are much more aware of the possibilities of there being bad stuff in the air that they breathe. And so they know now to keep that personal protective equipment, that self-contained breathing apparatus on for extended periods. Whereas the first thing you want to do when you come out of a fire is take off the helmet, take off your coat, take off your mask and things. And we've got to make sure that these people understand now, the young firefighters understand that it's very important to keep that mask on for extended times to breathe good, clean air.
Doctor, I know occupational health is one area of the medical practice that you really focus on. So when you see a firefighter come in, what are the types of things that you're talking with them about to sort of assure or help encourage their safety and their health?
We deal a lot with wellness, with several of the fire departments we're involved with down at St. Francis Trinity. We encourage them to stop smoking, ease on the alcohol, weight loss, weight reduction at some point for the firefighter. Physical fitness is very important. It's a very vigorous, difficult, physically demanding job on the fire scene. So to be in the best shape possible is really of great benefit for the firefighter.
Chief, are firefighters even allowed to smoke anymore? I know at least in West Springfield you can't smoke.
In Massachusetts, anybody hired after 1987 was not supposed to be a smoker, okay? We find that some people still chew tobacco, which obviously we don't care for, but they say we don't smoke. But they shouldn't be smoking cigarettes, cigars, pipes, anything like that.
Because we're tracking lung health, right?
Correct.
And there's also firefighters want to understand, if they come down with something, like we know that the people who responded to 9/11 Ground Zero have passed away from a higher risk of, or from cancer more frequently. There was a chief who just died recently.
There's been a number of firefighters that have passed away from exposures to the toxins that occurred at ground zero. One of the articles I've recently read showed that there was over 400 tons of asbestos released in that scene. And asbestos, once it gets in your lungs, it's tiny microscopic fibers that can tear and scar your lung tissue so that you can't breathe. So, that's going to be a big hazard for every responder that was on that scene for the weeks or months after that event.
And we know that men and women from this region went down and responded there.
I've had people from Pittsfield go and other areas, certainly.
But are the other things, we think about the old factories, the old warehouses, things like that, that firefighters in this region are responding to. Are there certain types of fires that if you get a call for, you're going to be more concerned about your health?
Well, the general construction from back in the 50s, 60s, up to the early 70s, asbestos was used in a lot of it, whether it was outdoor siding, insulation in the walls, covering piping for insulation and fireproofing. So anytime you break this stuff up, they use the term friable asbestos, and it's broken up, right, and those fibers get in the air and people can breathe them, that's when that damage can occur to their lungs.
But isn't it true firefighters are responding to fewer actual fires now? So is that also then giving you a leg up in this instance?
The fire rate is down, that's for certain. But the problem is newer fires, the older legacy fires had a lot of wood and cloth and glass and metal. Our newer fires, a lot of it are plastics and different chemicals, solid gasoline, really, when you start to look at it. The chairs that we're sitting on may have a wood frame, but they're covered with foam. You can feel the foam in there. When that foam burns, it gives off toxins that the firefighters can easily breathe.
When you're treating patients, are you seeing a difference in maybe a firefighter who's a person who's been a firefighter for a number of years versus a person who hasn't been on the job quite so long, what their lung capacity is, or just general health?
I think in general health, as the more recent firefighters, the younger firefighters are in much better shape. They're all very physically fit. Most of the fire academies that the firefighters are now required to go through for training are very physically challenging. They're in excellent physical condition, whereas the older firefighters, it tends to lag a little bit with their physical fitness.
Chief, you mentioned something I want to bring up. You said foam in this chair. That's another thing that the legislature in Massachusetts is looking at, is the flame retardants that might be on the foam, perhaps even these chairs or kids' safety seats. It's a double-edged sword because they're supposed to be flame retardants, but then if they are exposed to flame, what happens?
If they do get on fire, then of course they're going to give off these toxins that can be in the atmosphere. Okay, and anybody, probably the most susceptible people will be the victims inside that home. All right, children, elderly people, regular residents who could breathe that stuff in and easily be overcapacitated by, the chemicals in the air, okay? Firefighters at least have a good chance of surviving that because they do bring in their own air supply and have something clean to breathe while they're in there. It's making sure that they clean up afterwards so that none of those toxins remain inside their turnout gear, on their helmets, their hoods, the self-contained breathing apparatus. All that stuff has to be washed and cleaned immediately after every fire so we don't track it back in, to our workplace.
The Massachusetts Senate has approved a bill that's would ban 11 of these flame retardant chemicals. The House is looking at it. But Doctor, the Massachusetts Coalition for Occupational Safety has also said that passing a bill to protect people from these flame retardants is one of its top priorities. Is it something that you've talked about or heard about from an occupational safety standpoint?
Not specifically, but a lot of these flame retardants are just that. They help prevent the actual creation of flame. So we suppress fire. But the problem is when they get heated and superheated, they'll off-gas a lot of toxic materials, and that's one of the biggest concerns while you're still in that home, inhaling some of these toxic chemicals that can cause cancer.